Hello, my beautiful mothers. Welcome or welcome back to my channel. If you are new, welcome. If you are an old subscriber, welcome back to my channel. There are so many birth preferences that women chooses to birth their baby. Can give birth at home, on a beach, in a sea, or in the hospital. It depends on how you want your childbirth to be. And women do ask a lot of questions which I receive. Which is the best way to deliver your baby? Either at home or in the hospital. Yes, you can deliver your baby at home safely and sound, and you can also deliver your baby in the hospital safely and sound. There are so many benefits of giving birth in the hospital, and one of them is 1. You have access to NICU. 2. You have a staff support. 3. There is a pain control available for you in case you need it. 4. There is an availability of interventions in case there is an emergency. Hospitals are the most common place of birth in the world, with 98.4% of births taking place in the hospital in 2017. In this report, the committee considers hospital births to be those occurring in a hospital, whether a level 1 community hospital or a level 4 maternity unit. Among birth settings, hospitals provide the widest array of medical interventions for pregnant women and newborns. However, there is wide variation in provider types and practices among hospitals. Thus, the woman's experience may vary widely from hospital to hospital, depending on side factors at the hospital level of care: staffing, maternal fetal status, local values and culture, resources, and more. For example, a study of 88 hospitals in Michigan found that 43.2% of hospitals had no vaginal births after a cesarean section. Among the hospitals that had at least one VBAC rate from 0.5% to 48.1%. The study's authors concluded that the choice of hospital can significantly impact the individual chances of VBAC. Another study in California found that low-performing and high-performing hospitals, as rated by the California Hospital Assessment and Reporting Task Force, varied widely in measures including the low-risk cesarean birth, which is 56% versus 19%, episiotomy, which is 46% versus 2%, and VBAC 1% versus 2%. Care providers at hospital maternity care units may include nurses, obstetricians, family physicians, pediatricians, and midwives. Although family physicians and midwives do not practice in all maternity care units, some hospitals may also have specialists such as anesthesiologists, maternal fetal medicine specialists, and neonatologists. Immediately available or called despite their variation, the vast majority of hospital births are attended by physicians. So my beautiful mommies, this is the answer. If you are trying to birth a baby in the hospital, it is secure and safe to have a baby in the hospital because you are surrounded by professional medical care. I believe this video will motivate, encourage, and inspire you towards a beautiful, gentle, and comfortable childbirth. Now let's see how a beautiful mother of one, she is birthing her first baby in the hospital. Let's see how she delivered her baby in the hospital.
Times, women may be encouraged to breathe extra oxygen through a face mask, oxygen administration, to increase the oxygen available to the unborn baby. A review of 2 trials found too little evidence to show whether oxygen administration to the woman during the second stage of labor is beneficial to the baby.
Vi håller på till måndag när vi räknar.
Är det räknat imorgon?
Nästa
Nästa
måndag.
måndag? Ja, men då väntar vi.
Det är mer snart.
Using oxygen during labor and delivery has been going on for decades. This long practice is recommended by the American College of Obstetricians and Gynecologists to treat abnormal heart rates, which indicates the baby's oxygen level are low and cause health risks. It is such a common practice because thought is that by giving more oxygen, we are increasing oxygen transfer to the baby, said the study first author Nadini Raguraman, medical doctor. However, the results of this study suggest that oxygen is not necessary or helpful in these cases and that the practice could be safely discontinued for many women. Though maternal oxygen supplementation during labor and delivery is common to prevent hypoxia and acidemia in the fetus, it may be unnecessary according to research published in JAMA Pediatrics.
Nej, inte masken.
Nej, får jag inte ha den.
Ska jobba nu.
Nu ska vi vara med.
Så att du är med liksom. Det är därför. Man blir lite dizzy.
Jajamän.
In this woman's case, you can really tell she really needed the oxygen. The oxygen is helping her to thrive. The doctors indicated that she uses the oxygen.
Mycket bra. Du är så duktig.
Fortsätt.
Du kan.
Noga. Ja.
Du kan.
Har du mera? Jag tycker om mer. Om du har mera värk.
She is almost done because the baby's head is already out. The baby's head has emerged, which is also known as the baby's head crowns, or when the baby's head appears at the vaginal entrance. This process or this stage can be very, very difficult.
Har du värken? Ja,
Bra.
precis. Och så trycker du på
Tung.
där. Fortsätt. Tryck. Var inte rädd.
Slappna av. Slappna av.
Viktigt att lyssna.
Lyssna.
Jo. Och nu andas vi bara.
Andas.
Andas bara.
Andas.
Jättefint.
Jag slappnar av i axlarna.
Ringa in.
Just det.
Vi ringer bara in för som rutin.
Absolut.
Så låter vi bebisen komma ut. Så på nästa.
Ja. Nu är det nära, hörru du.
Kommer
Det är
bebis.
jättenära nu.
Ta din hand.
This was such a long labor and delivery. The woman is already short of breath. She have run out of breath, and this is a time that she need a lot of energy. The more reason why she was given an oxygen, because this can also stress the baby out, and the baby may need a lot of oxygen to be able to stay strong before he is born.
And now our little beautiful baby is born. Isn't this beautiful? Congrats to mommy, daddy, and the birthing team. They have done an excellent job and we are so proud of them. When a child is born, He needs to feel the warmth of the mother or the father. This gives the baby a sense of security, assurance, and protection. Remember, wherever the baby came from, he was loved, he was protected, he was given everything that he needs to stay healthy. And now the baby is in a different world.
Baby doesn't know anyone, but baby naturally knows the smell of the mother or the father. When the baby is given to either the mother or the father, the baby feels secure, assured, protected, and the baby will stay. Every newborn baby should be breastfed within the first 1 hour of birth, unless the mother is unconscious. Breastfeeding creates an unimaginable bond between the mother and the baby. Breastfeeding makes the baby feel full, loved, assured, and protected. Breastfeeding also helps with your baby's cognitive development.